Here is an alarming figure for those of us with aging parents. 59% of people who care for Alzheimer's patients report a chronic condition of their own. That's according to a new report released today. WRAL's Grace Haba found out just how big a toll caregiving can take.
My dad was 79, my mom was 77.
Dr. Scott Robert has helped treat patients with dementia in Durham for more than 2 decades, but says his biggest lesson in care came when he became a caregiver for his own parents.
I never imagined that I'd be in the position where, after they took care of us for so many decades, that the tables would turn.
Both of his parents, Bruce and Betty, were diagnosed with Alzheimer's on the same day in 2018. Bruce's dementia progressed quicker, and the father passed away in 2022 on Christmas Eve. Scott and his brother still help provide care for their mom, now in assisted living.
It's hard enough when it's one parent, but when it's both, it was, a full body blow. And the amount of stress that it put on my marriage, and also even my relationship with my brother, who was also functioning as a caregiver. The simplest tasks took, a lot of effort to get them done.
Scott says his own experience has now changed the way he interacts with his patients and their loved ones.
Simply me living in Durham, them living in Cary, me going to pick them up, traveling back to Durham, going to an appointment, driving them back and me home. That was a 6 or 8 hour day. And I have been asking of families for 20 years to go, jump through these hoops, and I'm a lot more sympathetic, and I try to make things a lot more efficient for them if I can, and get one more test done before they leave the hospital that I know will save them time and stress and effort.
In Durham, Grace Haba, WRAL News.
Boy, it sure is a story so many can relate to, right? Let's go through a few more major findings in that Alzheimer's Association report released today. In North Carolina alone, an estimated 210,000 people live with Alzheimer's. That's 30% more people since last year. Caregivers have reported stroke, heart disease, cancer, diabetes, plus, of course, emotional stress. Caregivers reported the most stressful parts are often the cost of treatment and the logistics, just like that doctor mentioned, around all of the visits and phone calls.
What we hear from a lot of caregivers is that they are so in the emotional and physical reality of caregiving for their loved one that sometimes their own health concerns take a back burner to that.
We have more information and resources for help caregivers can get under the Health tab on WRAL.com.